So the three questions, Anna. The first one is, what aspects of the current family justice, youth justice, and child welfare system act as obstacles to achieving good outcomes for adolescents? So what are the key blockages in the current system that stop us from doing what we know we want to do for young people? And we're really focusing here on looking at kids coming in to care later on. So we're looking at adolescent entry and across those systems that you know so well. Anyway, off you go.
Okay, well, I suppose I'd like to start earlier than them coming into care, the preventative side. And we really need to be looking at the root causes of why adolescents are presenting with problems that lead them to coming into care. I mean, adolescents, teenagers come into care for lots of various different reasons. So we are talking about a very heterogeneous group. And I suppose what I'd say is I'll talk at some stage, I'd like to talk about separated, unaccompanied migrant children, asylum-seeking children. But at this stage, what I'm now talking about is children who are coming in via the sort of child protection and youth justice system. So children, adolescents at risk of harm. And I think we need to tackle some of the root causes. We need to go back and look at structural inequalities, the rising levels of inequality in our society, how we know from Paul Bywater's research that the majority of children that are coming into the care system are coming in from poor backgrounds, from families who are struggling in circumstances of poverty and other forms of inequalities. Around adolescence, there is a overrepresentative. I mean, it's quite complicated when you look at race and poverty and the statistics around that, but certainly there's really strong evidence to suggest links between older adolescents, race, poverty coming into the care system, and particularly for Black young people. It's complicated by if you look at the statistics around South Asian young people at different ages. But I think we need to really be looking at what are the resources that are provided for young people and their families. We've seen years of austerity that have absolutely decimated youth services. We need to go back and actually, as a profession, I mean, as a social worker, I'm talking about it, but as child welfare professionals, and, really advocate against these cuts that are happening and say we need to create a different community and a different society that really starts by looking at what are sort of economic, social, cultural barriers to ensure that children can be cared safely in their families and their communities and that they can flourish. So it does look at sort of, it is looking at poverty, housing, other basic safety net resources. It's looking at the community-based initiatives around youth services, really crucially around schools, around school exclusions. There's a high risk of young people being involved in sort of exploitation, being exploited in different ways, sexually, criminally, if they're excluded from school, if they're marginalised by being outside of the systems, and that we need to look at some of the institutional racism within those systems as well. So we need to go back to looking at the preventative work that's done with children and young people before they come into care, and that's absolutely crucial. We have a very risk-averse child protection system, but it's a system that's very focused on family risk, individual family risk, risk within families and parents seen as being sources of risk. And we need to widen our focus to look at context and wider society that harms children, that harms adolescents. So looking at ideas around social harm as well and how they intersect with different forms of inequalities and how they sort of interact with children's development and parenting practices and communities. The child protection system, I think Rotherham and other examples showed that the child protection system really is not fit for purpose for adolescents, and we need to. I mean, there have been lots of initiatives that are looking at that. So I'm not saying nothing's been done, absolutely, but we need to. And I'm not saying that some young people and children are well protected and looked after, but we need to aim for that for all. I think we need to look at the sort of as Carleen Furman has done and others in contextual safeguarding, the neighbourhoods, the localities where children are and they spend their time, young people, but actually also look at wider sort of structural systemic inequalities that are impacting on children's lives. So that was... So that's about trying to prevent children coming into care and going back to that.
What about, do you want to say anything about the court system? I mean, which you're familiar with in the family justice system. Are there things within the way that the justice system operates once that, if young people move on because they have fallen through nets coming into care, going into youth justice systems? Do you have a view about how the court systems work?
I can't really comment on the youth justice system. That's not an area of my work other than what I've read around the research, and that we need to address some of the systemic racism and inequalities within that system. In terms of the family courts, very varied. Adolescents come in for very varied reasons, because the beyond parental control is used in ways in adolescence as a significant harm criteria in ways that it's not for younger children. So certainly in my experience, adolescents will come into the care system because they're at risk of significant harm from parental care. Sometimes I think, certainly in my experience, going back to what I'd said earlier, the focus has been on parental harm and the home environment for these adolescents that are really quite at risk in the community, and there isn't sufficient focus on the risks within the communities, within the context where they're living, and the supports that can be provided. So I think sometimes, certainly in my experience, that the blaming approach towards parents is replicated for adolescents in the child protection system. And what it is, it's missing some of the really fundamental problems that are going on in this young person's lives. Certainly it could be a factor, but the way the sort of significant harm criteria in the family justice system is structured, it is often quite a parent blaming, where actually we need to be looking at other solutions for these children. So certainly I've come across young people there are young people that I've come across that have come in to the family justice system for being at risk in the community, for having experienced abuse at home. So there are children that, are experiencing abuse at home, whether that's physical abuse or sexual abuse, that are coming in to the care system. And actually, I'm sure that there are a lot of, and I know that there are a lot of children that are supported in that way. The care system does help a lot of children. In terms of the court process, I do think that the guardian and the children's solicitor and the separate representation system, in my view, works quite well. I think it's a very important thing to keep hold of. Interestingly, I have been involved in recently over the last few years, because I don't do much work in the family courts, and I get asked, I just do a few cases, but I have been asked, and it could be just because of the solicitors that ask me, adoption breakdowns. And adolescents that have come back into the care system through adoption breakdowns. And some of the young, and again, I found the blame approach of the child protection system and the family courts, that you have to prove that these parents are at fault, is really deficient in those really complex cases and is not particularly helpful. For adolescents, because of the complexities of their lives. There are the sort of deprivation of liberty cases, certainly, that I've read about, I haven't been involved in. And there was a recent one I read about. So the lack of actually resources for treatment for really, really troubled young people is problematic. Another problematic issue I think that's been raised recently is unregulated accommodation, and 16 and 17-year-olds, well, under 16 and 17-year-olds, but including 16 and 17-year-olds that will continue in unregulated accommodation without a care requirement. So there's quite a lot of complexities and difficulties, and it's not going to solve all the problems, but resourcing is a really big issue.
Okay. Patrice, is there anything you want to come in on there?
I know you touched on it a little bit, Anna, around the child protection system not being fit for purpose. But I'd like to link that in with something else that you said about the system, there being a lot of oppression and racism in the system and a lot of inequality. And I'd like you to talk a bit about how those two connect and the impact that has on adolescents coming into care and adolescents going through the youth justice system, and your opinion on that.
So I think, from the youth justice system, it's certainly, I can't talk, as I said, from personal experience, but the statistics are pretty stark. The Lamy report, for example, is pretty stark around the overrepresentation and the harsher treatment that Black and other minority ethnic young people receive within the criminal youth justice system. I wonder, and I think that all links with some of the literature around some of the harsher treatment that are seen as sort of more dangerous or more difficult of Black children, and particularly Black boys within the education system, and the school exclusions. Again, I think certainly my understanding is overrepresented amongst school exclusions. So it's how these children are seen and treated, really, and the stereotypes and assumptions that underpin some of the practices of professionals, and that they're less deserving. Certainly in terms of understanding the care system and how wider factors impact around the treatment of different young people, I would really look, I'd highlight the treatment of separated and unaccompanied migrant children, and how actually the sort of culture of disbelief, the hostile environment around refugees will intersect with values and assumptions about being less deserving, and how that can be played out in terms of differential treatment, being suspicious, age assessments. And I think particularly at a time, a number of studies, and there's one called Becoming Adult that was done, Nando Sigona, I think, at Oxford, really looked at how at times of austerity, local authorities' budgets are squeezed, and they particularly looked at unaccompanied asylum-seeking children as seen as being a drain of resources and less deserving, not being followed up when they go missing in the same way as other children. So differential treatment, and how discrimination, how prejudice, institutional racism, and in this case it was particularly around immigration and the hostile environment, impact on professionals' values, team responses, organisational responses. The whole age assessment process is a classic example of treating people with the culture of disbelief and as of lesser value. Does that long-winded answer?
No, it was great. I think I definitely would agree with a lot of what you're saying, and it's interesting, the culture of disbelief, and I never reflected on age assessments in that way. Just I've completed quite a few in my time, but just thinking about the disbelief and that culture, I never thought about that, because I try to enter age assessments with an open mind and a loving mind, but still it's definitely creating a culture of disbelief in that process. I will not probe anymore. I'll go on to the next question. I think I could talk about that for a while. So,
well, let's hope we have a bit more time at the end to come back to. So moving on, Anna, now the next question, the 3 things, was really in relation to whether 3 or more or less about the current system that you think is worth holding on to as we try and develop, in our thinking at any rate, a brave new world, which we can come on to next with Mike. But so for what's working currently, and I think actually one of the things you've mentioned is a separate representation of children once they get into court in family law proceedings, public family law proceedings at any rate. Do you want to talk a bit about either about that bit more or about other things you think do work or could work and ought to be held on to?
Within the sort of court system or more generally?
More generally. So, for example, you talked about problems of child protection. Is there elements of that work, elements of the legislative framework that work? What other things you think are worth holding on to?
I mean, we do need to protect children, so I'm not saying we should throw it all out. But we need to really be taking a much more broader view around the barriers that families face and trying to address that on a wider level. I think we should really be holding on to and developing further any youth and community services we've got. We need to really look at localized provision as well, and how we can support youth provision and co-produced youth provision. I mean, there's some really interesting groups that have young people's groups that have and youth groups that have developed. Forefront is one that is about youth empowerment, that works with young people to create services. And I think certainly generally coming out of this pandemic, we need to really think about how we can work with people and within their communities and develop the strengths within their communities and have support people to do that. So I would say hold on to any good and develop any good youth community initiatives, being one. The family courts, a separate representation. I guess other, the one thing that I think is really important, and I don't really know how they're working so well now, is there's children in care councils, getting young people to be part of advocacy, whether it's sort of, not necessarily individual, it could be individual advocacy, but more policy advocacy training involving young people in those sort of initiatives. I think participation initiatives are really important to hold on to what we've got, but also develop further where we can to get the voice of young people. We need to, a big thing I was wanting to say earlier, but we need to also think about how, as professionals, as social workers, as other professionals, as youth workers, we do develop these relationships and that they're meaningful relationships, and listen to people like Mike and others about what that means for young people and how that, what that involves, and, how we can best do that, really, to work alongside them. And I think that's what certainly the work that's looked at child sexual exploitation, etc., has really showed us, is that we need to find ways of building and maintaining sustainable relationships with young people, whether they're in care or whether they're in the community. And on their terms, really, not on our terms, what they're finding out what their terms are and doing that. Yeah. Which sadly, I think with all the changes in a lot of local authorities, in a lot of social work, teams, we're not that great at, because of the turnover of staff. So, it goes back to also looking at organisations and how they support and maintain staff to do that.
Thanks. Any follow-ups on that one, Patrice, that you want to come in on?
No, not right now. I'm just reflecting and digesting that one.
All right. Mike, do you want to ask your question?
Yes. So, Anna, amidst all the complexities and all the challenges that we have to face within, obviously, the care system, criminal justice system, what is your vision for the future? Where do you see us going? Where's the hope?
The hope, I think, sorry, I'm not being very hopeful at the moment, but no, I do think that actually, the reason I'm not being very hopeful is partly because is a lot from the pandemic, but I think there's a lot of people that's saying that this is a crisis that has helped us make us think differently, and we need to think differently, and we need to build on relationships and interrelationships. So the hope, I'd like to see much more preventative work done with young people. I'd really like to see sort of community initiatives trying to support young people, giving them alternatives, hope, choices in their lives, hope, giving them hope about education, about future, about employment, about life, and doing that, for young people in the community, but also obviously for young people in the care system, and doing that in a co-produced way. So doing that with young people to really think through and involve them and their families and networks, to think about questions about how can we make this community, this place, this where we're living, as well as this wider society where possible, a place where children flourish or young people flourish. So not I want to see a more positive approach, not just how do we protect children from harm, and I do think we need to protect children from harm, but actually how do we promote children's capabilities? How do we make them flourish? How do we give them a voice in terms of thinking about what that means and what that looks like? Is that helpful?
Yeah,
Mike?
Definitely. So getting young people, the community, the families to tackle the issues that we all face together, basically.
Together, absolutely.
Yeah,
Definitely. Yeah. And if there's one thing that we take from this horrible last year that's been really difficult for so many, is that we have to do this together. There's no other way.
Yeah, beautiful.
Patrice, are there other things now you want to come back on?
Yes. I feel like you've touched on so many really pertinent topics, but the thing that I think I struggle when I'm working in the field or working with other social workers and other practitioners, I find that it's not always the tools that we have. It's sometimes about how we use the tools. So if we go back to what you mentioned about age assessments and just even communication and coming together, for me, it's about how do we do that? And I guess I'd like to ask you, just because we have a bit of time, for you to just expand a little bit on some advice that you could give social workers and practitioners in tackling some of these areas that you mentioned, and to be more focused on equality, to be more focused on community-based social work. How would you advise practitioners to move forward in that loving, holistic way?
Firstly, values. I think you've got to check your own value. You've got to really examine your values about equality, about justice, about care, practice with an ethics of care. I think it's really, people going back to fundamentally their values and their assumptions. And, for profession, go back to some of those, core principles of social work, such as social justice, such as human rights. And so that's a starting point. I think really think about what you do does. I think that's the right way of saying it. What you do. Yeah, so the impact of what you do. So, to think about how to really be able to reflect on how this young person might be experiencing me. How are they experiencing my involvement with them? Checking that out with them. What can I do better? How can we make this work together? So seeing it as a standing alongside, standing by, a collaboration, the relationship. It's difficult, but to go the extra mile when you can. That's what's come out from lots of the sort of discussions, research that I've done with young people and parents is just to go that extra mile, to show that you care, to show that you're a valued individual, not just as in many people would say, a case, a number, to make that, to give that humanity really, and to be kind. Kindness comes out quite a lot. I suppose what I would say is that, we can do good work with individuals, but I'll also, try and change within organizations, challenge discrimination, challenge inequality, think about, ways in which policies and procedures might compound, discrimination, compound inequalities, challenge some of the statements around, for example, around asylum seeking age assessments. You can hear that quite a lot around people in poverty. And then I guess as a group, as a professional, make alliances with other groups and be an activist for a better world, for a better society. And give, I suppose using power to give voice to people who are less powerless, who are more marginalized as a profession. Using what we see, we go into, not so much we, social workers go into people's lives. They're seeing the terrible structural inequalities that people are facing, the lives that they're leading. Use that to campaign, to learn from, to think about, and think about context. The social context, the economic context of the lives of children, young people and their families that you're working with, because it's really important to take that wider contextual view.
Can I? Thanks very much. That was. I'll get you. You can come back in again, Patrice. In 2 seconds. I just I'm interested. You're very clear about the need for really more preventive work, more community work, more focus around that level of support locally, with which I agree, of course. I think we have to, if we assume we're probably not going to have a lot more resources in the immediate future, do you see ways in which we can still work towards achieving a greater shift away from the individual risk focus to a more, community-based preventive approach? Do you think that's achievable?
Yes, I mean, well, I hope so. Yes, I do think it's achievable. How we get there, I'm not sure, but I do think it's achievable. I think it requires culture change. I think there are examples of places that are doing things well and doing things, doing things in that direction. And I do hold Camden up as one example of that, in terms of trying to develop some of the community resources that are around. I mean, we're not going to get more money. I think you're right about that. So, but I do think in the longer term, it will save money. It's about how we get there to support families. So it is about choices that are made at local levels, I would say, about supporting community initiatives, supporting groups that are developing within the community, but also within the social work organisation, the local authority organisation, trying to build up sort of more co-production opportunities and initiatives with young people, with families, to redesign services, to just start thinking more about the wider context of people's lives and moving away from that individualized risk focus will require, I think, people asking questions about what we're providing and what we're doing and why we're doing it, and can we do things differently. The court system is really, really expensive, and it's, I think a lot of people, I think Andy Bilson's work, again, Paul Bywater's work, Callum Webb, have shown how really if we can shift some of those resources, front-end preventative work, we will have more money to develop those. So I think although we can't expect more money from, much more money from this government, I think it is about communities and local areas thinking about how they might be able to do things differently to free up some of that. Group work. When I started as a social worker last century, social workers were involved in those community initiatives and group work. Trying to bring social work back into that as well in some way is really important. I worry that we do need to. We can't just retreat from the risk without providing the support. I think we can't just put more money into a risk-averse system, but we can't just take the money out of that and not provide something else. We do have to address some of the root causes of people's problems that lead to children coming into the care system. That will involve central government, obviously, and that we can't hold out. We can't expect, I don't think, huge changes at the moment, but we do need to really think how we can work locally and work across learn from each other, really, working across local authorities, working across with NGOs as well, or third sector organisations about what we, how we can support, how we can work with, to prevent some of the difficulties. But we can't retreat and not provide that. That's my worry, is that. Yeah, people take the argument about the risk monster, or that it's too risk averse, and say, oh, we've got to become less risk averse, and in this current climate we're not providing anything else. We can't do that. We have to go back to communities and say, how we have to ask the different question, what can we do to support our children to flourish in their communities? How can we work together on this?
Thank you, Anna. Patricia and Mike, any other things you'd like to ask before we start winding up?
No, just a lot to think about, and we could talk about this for a very long time. But a lot to think about.
No further questions. I literally what Patricia said. Anna brought up 1,000,001 different keywords that could each be used for their own hour conversations. So it's literally, I think it's definitely been a great opening ground.
Yes,
I thank you. I've really enjoyed talking. You could go on. Yeah, thank you.
That's great, Anna. Thank you very much. Bev and Seth, have you got any questions that you'd like to?
As ever, I would love to. Thank you, Anna. That was really rich. I loved particularly what you said about making sustainable relationships with young people on their terms. That was really strong for me. And I think that kind of speaks to when you keep on suggesting we widen the lens. And I guess I was sort of hoping you might touch upon how we might do that, how we might get those relationships with those young people on their terms. How do organizations kind of find that level of attunement that it would take to make that possible?
I mean, start engaging with young people, sort of the groups that are existing. There are some. I'd go. I mean, have you come across Forefront at all?
I was going to ask you to describe. That was, I stopped myself making that question go too long, but I was going to ask you to describe that youth provision Forefront and describe maybe some of their work, if you could.
I'm not an expert on them, so this is just my understanding of them. But they are very much, it's based in North London. It's an inspirational woman who started it up. So, and they campaign. I mean, they have a number of activities, but they campaign. They do campaigns. They support young people. They advocate for young people around the criminal justice system and in other ways. I'd hate to speak for them. I think you need to speak to them. But I do think, but that's just one example of lots of other examples of youth groups and youth organisations that I suppose engage in dialogue with young people in the area. What are your needs? What are your hopes? What's preventing you achieving that? How can we support that? And really set those dialogue, to start off with those dialogues, and then develop them further. And I think one thing that a place like Forefront does is they stand by young people. They're there for them. And I think that's what a lot of young people who are marginalised by so many structural inequalities need. They need people to say, yeah, you matter, you care, we care about you, and we're going to work with you to try and achieve better. Two things quickly. One is the Unity Gym, Will Mason. I mean, if you want to talk about youth groups, Will Mason, who was involved in Paul Bywater's study, he's an academic at Sheffield, but he's as a volunteer, he's very involved in Unity Gym in Sheffield, which works with Somali young people within that community. And I'm sure there are a number of activists there that would, if you were interested in talking about that.
May I just, forgive me for backtracking, Anna, you suggested that the Guardian system works well. Would you please just pick up on which particular elements you feel are the good things about the Guardian system?
It was the dual representation system. I think I do support the Guardian system. I was a guardian for many years, but under the old system, so I'm an old.
Would you like to describe the good bits about the dual representation then?
The dual representation, I think that's really important. So children are represented by a children's guardian and a solicitor, and if they are Gillick competent, so if they're able to give instructions and their view differs from the guardian, they're represented by their solicitor, and I think that's important for adolescents. That's really important that they get that ability to represent themselves, to be represented themselves. Yeah. So no, I think that, and I do think. There are difficulties with Kafka's, but we've got to keep the Guardian system. I think that's really important, the Guardian and the dual representation system. Yeah.
Thank you.
I think there was suggestion that maybe the independent reviewing officer role might not continue in the same form as it's done. I think the independent reviewing officer is a really important safeguard. Again, it might not always work. There might be problems with it, but it's a really crucial safeguard. Yeah, particularly in local authorities where there's so much flux and change, and I do think they can play a key role. I think it varies. I mean, I think in principle it would be better if they were independent, but still had a voice in there. So it's got to be independence, but with a sort of role, a voice, or some authority really within that system. I think it can. I mean, I've come across some really good IROs even within the system. So in all of this, a lot of it does depend on the individual and the team that they're working in.
Can I just ask about IROs? Is it still a thing where they only do checkups? I think it's like once every 6 months or something like that. The only thing that I'd say is the thing that goes against that is the amount that can happen within 6 months within a young person's life. Because within 6 months of a review, well, let's say a plan gets made, within 2 weeks, 1,000,001 things has gone wrong for this young person, and now they've had to make changes and they've had to divert everything. So it's really hard for someone to keep an eye on a case once every 6 months. That would be my only stance at it.
That maybe they need to check in between. Or have some,
So they would check in between with the social workers and to make sure that the plans are, but not the young person. Yeah. So and that's the thing. Yeah. And it would be a hope that your social worker would be really working in quite a loving, detailed way with the young person. But of course, we know that is not always the case, Mike. So 100%.
I do completely agree in it. I was just I had to mute because I was laughing in it because literally, it's true. It's obviously I do agree with that in the same sense of I can understand professionals from a professional level, despite receiving the treatment that I received as a young person with these professionals. So we can have hope.
We have to be hopeful.
Yeah, we can have hope. Yeah.